Our arteries are like highways for our blood. They carry oxygen-rich blood from the heart to the rest of the body. But sometimes, these highways can get clogged. This clogging is often caused by a buildup of plaque. Plaque is a sticky substance made up of fat, cholesterol, and other things found in the blood. Over time, plaque builds up inside the artery walls. This buildup narrows the artery, making it harder for blood to flow through. If a blockage becomes severe enough, it can slow or even stop blood flow. This can lead to serious health problems like chest pain, heart attack, or stroke. That's why it's important to address artery blockages. One way to do this is through a procedure called angioplasty. Angioplasty helps clear the blockage and improve blood flow, allowing you to live a healthier life. Angioplasty is a minimally invasive procedure used to open blocked or narrowed arteries. It is also known as percutaneous coronary intervention, or PCI, or balloon angioplasty. Angioplasty doesn't involve major surgery. Instead, doctors use a catheter, a thin, flexible tube, to access the blocked artery. There are different types of blockages that can occur in arteries. Some blockages are made up of soft plaque, which is easier to break up. Other blockages may consist of harder plaque or calcium deposits, making them more challenging to treat. Angioplasty can address various types of blockages. The procedure aims to restore blood flow, relieving symptoms and reducing the risk of future cardiac events. Angioplasty is typically performed under local anesthesia. This means you'll be awake during the procedure, but you won't feel any pain. Here's a step-by-step explanation of how angioplasty is done. 1. Accessing the artery. The doctor makes a small incision in the groin or arm. They insert a catheter through the incision and guide it to the blocked artery using X-ray imaging. 2. Positioning the balloon. Once the catheter reaches the blockage, a tiny balloon attached to its tip is inflated. This compresses the plaque against the artery walls, widening the narrowed space and restoring blood flow. 3. Stenting if necessary. In many cases, a stent is placed inside the artery to keep it open. A stent is a small, expandable metal mesh tube that acts as a scaffold, preventing the artery from collapsing again. 4. Completing the procedure. After the balloon is deflated and removed, and the stent, if used, is in place, the catheter is withdrawn. The incision is then closed with a few small stitches. The entire procedure usually takes about an hour or two. Most patients can go home the same day or the next day after the procedure. Angioplasty offers several benefits for people with blocked arteries. It can relieve symptoms. Angioplasty can quickly improve symptoms like chest pain, shortness of breath, and fatigue. It can reduce heart attack risk. By restoring blood flow to the heart, angioplasty can lower the risk of a heart attack. It can improve quality of life. Angioplasty can help you return to your normal activities and live a fuller life. Like any medical procedure, angioplasty carries some risks, although they are generally low. These risks include bleeding or bruising. There is a small risk of bleeding or bruising at the catheter insertion site. Blood clots. In rare cases, blood clots can form in the treated artery. Restenosis. There is a chance that the treated artery could become narrowed again over time. Overall, angioplasty is a safe and effective treatment for blocked arteries. It has helped millions of people around the world live longer, healthier lives.